Hi everyone, my name is Rachel. I'm project coordinator here at PVRI, and I'd like to start by saying a very big welcome to today's PVRI webinar, From Data to Action, Exploring the Pulmonary Hypertension Global Patient Survey Data Dashboard for Patient Associations. So before we begin, I'm just going to go over some housekeeping. So throughout the session, we encourage you to add your questions to the Q&A function. You can find this in the toolbar at the bottom of your screen. We'll be going through the questions, and after the presentations, we will try to answer as many as possible. To enable translated subtitles, first click Show Captions in the Zoom toolbar, then click the arrow in the top right and toggle on Translation, then select your caption language. I will also post these instructions in the chat. At the end of the session, Zoom will prompt you to complete a short feedback form. Your input really helps us shape future webinars, so we'd really appreciate it if you could fill this out, even if you've attended a previous webinar. And finally, a recording of the webinar will be available on our website later next week. I will now hand over to Matt Granato from PHA USA to begin today's webinar. Thank you, Matt.
Thank you, Rachel, and hello everyone and welcome. And thank you again for joining us. Like Rachel said, this is the PHGPS webinar From Data to Action, Exploring the Data Dashboard for Patient Associations. I'm Matt Granato, I'm the CEO of PHA in the US, and I'm also the chair of the PVRI PHGPS Task Force. And I am pleased to be co-chairing today's session with Hans Cora from PHA Europe. We are also joined by Dr. Paula Appenzeller, who's the Clinical Research Fellow at the Royal Papworth Hospital NHS Foundation Trust in Cambridge, who will actually guide us through the PHGPS Data Dashboard and help us think about how patient associations can use this data in very practical ways. So today we have three main goals. First of all, we want to thank the patient associations who supported the first phase of PHGPS. We could have not done it without their participation and promoting the survey to their patient population. Second, we want to share progress and show you how the findings are already being used. And third, we also want to introduce this dashboard as a very practical way, as a resource, and invite your thoughts on what should come next as we look ahead to round two. We want this to be a very useful and open session. So like Rachel said, use the Q&A or the chat function to share any questions or reflections as we go. We're going to try to answer them all. And if we cannot come to you live, we'll make sure that your comments are captured and considered as part of the next stage of PHGPS. So before we move into the content, I'll hand it over to Hal to say a few words about the role of the patient associations in this important work. Hal.
Thank you, Matt. Could I have the next slide, please? The patient associations played an important role in both development and also helping to get patients and carers to take part of this survey. And it really meant a lot because we had a great success with almost 4,000 patients and carers from 90 different countries. And the survey was available in 22 different languages. So let me just talk a little bit about how this worked. Like in our case at PHA Europe and Global, we used an AI tool to translate the survey. And then we had a person that was a native language speaker that also had a good understanding of English to check the translation and check it up against the original English question. And this was tough work. I know it because I did the Norwegian translation. And I think we did 12, 13 translations and languages. So that was the first part. And then the second part that the association played was to try to get members and the PH community involved to use the survey and to answer survey questions. And that was obviously a great success. So this is the largest global survey of its kind. And of course, with so many participants from so many places in the world, we get a very good understanding of the patient needs, priorities, and experience. And this has helped us to develop what we call call to actions that we will talk about later. And also this is a goldmine for researchers and so on to use all this valuable information. So if we look on to the next slide, we can see a little bit about where most responders or participants came from. So if you look at dark blue, those are the ones over 400 participants. And we see North America and South America very active, and Europe also. We see participation from almost all over the world. And of course, when we move on to the next survey, the follow-up, it would be nice also to see more participants from, for instance, Africa and also Asia. With all this participation, as I said, the data has been very valuable for both researchers and I think also for the associations and the PH community, because now the PH associations can go in and check with this dashboard the results of the survey. They can use this for advocacy work. They can use it to check where they have maybe issues where more work needs to be done. You can go in and check how one country is doing compared to another country and so on. So this is going to be a very valuable tool. And then we hope that the associations will continue to play a big role as we now move on to the PHGPS round 2. So I think I will hand it back to Matt, who will briefly remind us that what PHGPS was set out to do and what has happened since round 1.
Thanks, Hall. I just want to show you one stat that's important. Now, we asked the question, how many participants were part of a patient association, and just a little over half were part of patient association. So that demonstrates, one, the role of the patient associations in reaching out to their patients, but also how prevalent they are around the world. For anyone who's less familiar with the Global Patient Survey, it was actually developed so we could better understand the experiences, the needs, the priorities of people living with pulmonary hypertension. And it was designed to capture the patient perspective on a global scale and then turn those insights into action. So since the first phase, the data has helped informed published papers and has contributed to a very wide conversation about what needs to change for patients. One important outcome was the development of the 10 calls to action. I think that's the next slide. Here you can scan this QR code and get to all the papers that were published out of this data. So I encourage you to do that now. I'm just going to give you a minute so you can land on the PVRI page that has links to all the at least 4 papers that were published out of this data. And on the next slide, you're going to see the 10 calls to action. So these have helped frame priorities and encourage follow-up activities. So we've seen some momentum out of these 10 calls to actions, including at the PHA conference last June, where I want to give a shout out to Migdalia Dennis from Latin Health Leaders. She organized a hackathon, a way to hack 4 of these 10 calls to actions to implement them at the local level. How do we make these very abstract calls to action help communities or patient communities in their countries. And this is a really good example on how patient experience data can move from findings on a paper into very practical discussion and collaboration and problem solving. But today we want to focus on the dashboard, like I mentioned earlier, to help both researchers and patient associations access and explore the data more directly. We hope it will support local conversations at different levels and help these different patient associations identify the insights that are the most relevant to their own communities. So with that in mind, I'd like to ask Dr. Appenzeller, who will walk us through the dashboard and show how it can be used with the patient association lens. We would also encourage everyone who's listening to think about what questions the dashboard helps you answer and where there may still be some gaps. Please do add those reflections to the chat and the Q&A as we go. So Paula, why don't you go ahead?
Yes, thank you very much, Matt and Hal, for the introduction. I'm just gonna share my screen. So you should be able to see the dashboard. Can some of you confirm?
Yes.
Okay. So yes, hi, I'm Paula. I'm a clinical research fellow in Cambridge, and I'm helping the PHGPS Task Force with all things data related. And I will now take you through the live version of the dashboard that is currently available on the PVRI website. So you can find the link. Maybe we can also send a link into the chat box. So if you want, you can follow along while we go through it. I will show you, we have some aims to show you how to navigate this platform, how to apply the different filters that we installed, and also maybe to show how we could use it to answer some of the questions you as a person or as a patient association might have. So if we click on the link to the dashboard, you can see we land on a welcome page, and we have different options of navigation. You see the bar at the top where you can navigate, and to the side on the left where you can click through the different sections of questions. I'm going to collapse this bar to have a little bit more space. So we have different, there's a subset of questions from the PHGPS that were included in the dashboard. It's not all of the questions, but it's quite a good overview over the different topics. If you want to discuss the full data set, you can always contact the PVRI to get more information. Then we have different filters that you can apply. You can apply and to view the results by region, by country, by diagnosis type, by respondent type, or by gender. At this point, it's important to note that you can only apply one filter at a time, but we can see how we can work around this. And also, there's another note that we need to be careful of. We have any category with fewer than 5 responses has been hidden to preserve the anonymity of the respondents. So there's a possibility that some countries might not display individual level data. So on this welcome page, you can also see the map again, which includes all of the countries that participated in the PHGPS and also how they were grouped into different world regions. I prepared 5 different examples to go through and just to show you how to apply the different filters and to give an overview. We're going to start in the demographics tab. So if we click on the demographic tab, it will be redirected. You can see there's now a new field where we can filter. And you can see down below, you see the different questions that you can see, where people are from, who responded, their age and sex. So let's check. We might be interested in the results of a single country. So let's apply a filter. We can go to the overall category. We can choose country. And then we go through the subcategory. We can choose all the individual countries. I'm going to pick Austria. And then we can see the different results. So as I said before, we can see here the age distribution of all the participants in Austria, plus their gender distribution. What we can see here is that there is no respondents in the pediatric space. So they have no respondents aged 0 to 15. And this could be 2 different reasons. This could be because there were really no respondents from Austria that were this young, or because it was less than 5. So at the moment, we this is not, we can't decide which one of the two options it is. If we pick a different country, let's say we want to switch, and we're going to switch from Austria to Bolivia, we can see here in Bolivia we don't have any of the answers, and that is because we have less than 5 participants from Bolivia. Now, if we still want to see Bolivian data, the thing we can do to work around is we can add some countries that are in a similar area. For example, we can add Argentina, Brazil, and, for example, Chile. And now we can see the data for all countries together. And will still give you a reasonable idea of what's happening. So now we can see we have data from all the different age categories, and we have their sex distribution. If we're finished with our selection, we can use this button to clear filters, and we'll go back to the overall view. This was the first example. You're also welcome to put questions in the chat as we go along. If you have any questions, I will try to keep an eye on it. The next example, we're going to switch tab. We're going to diagnosis. In the diagnosis tab, we can see the diagnosis classifications of patients who answered the questionnaire, subdiagnosis, time from diagnosis to symptoms, and if the conditions has changed, and information about transplantation. Again, we want to apply one of the filters. So the next filters we're going to try out is the respondent type. So first we're going to look into all the pediatric responses. So again, we click on category, we choose respondent type, and in the subcategory, we will start with pediatric. So we can see that for the pediatric cohort, most of the patients had group 1 PH, and we only had a couple of patients from group 2 PH and some who didn't know their diagnosis. And when we look, this is now, for example, an example you could have and a question you could have. You can see out of 104 patients with idiopathic PH, 14 had heritable PH, for group 1 PH, 14 had heritable PH, which is around 7%. Now we might be interested to see how this changes in the adult. I'm sorry, it's a 14%. So out of the 104, 14 had heritable PH, so it's a 14% with heritable PH. If we now switch from pediatric to adult patients, so we choose patients and proxy. It's important to know that for adult patients, we choose patient and proxy because all the proxy responses relate to adult patients. So we can see that the answers have changed. We have 2,066 patients with group 1 PH, and of these, 151 have heritable PH, which relates to 7%. So we could, for example, now compare pediatrics and adult populations. We can also see that there is a lot more, the distribution of all the diagnoses is more spread out in the adult population. Again, we would clear the filter and we would be back to normal. The next section we have is the treatment section. It gives us information on what medications are used, if patients experience side effects, what side effects they have experienced, and if patients are using oxygen. And for the next example, we are interested in our patients using oxygen. We can see that if we hover over the pie chart, you can see that 45% of patients are using oxygen as part of their medication in an overall population. This might differ from world region, so we are going to check the next filter, which is the world region. We go back to category, we choose region, and we are looking into, as a subcategory, we're going to start by looking into North America. So if we choose North America, go back to the question, you can see that oxygen use in North America is fairly high, with 60% of patients who participated in the survey using oxygen as part of their treatment, compared to only 45% in the global population. And we want to compare this to Europe. So we need to go back and change our filter from North America to North Europe. And now we see that in North Europe, it's only 26% who are using oxygen. And I think this is for example, now from a research perspective or even association perspective, really interesting finding. And it's surprising. And this is something that shows the strength of the global patient survey, to see that from a patient's perspective, we can really see differences in treatment between global regions. And this number, interestingly, doesn't change much if we add other parts of Europe. So we can add on to North Europe, we can add on Central Europe, we can add on Southern Europe and Western Europe. And we can see that the number is still only 34% that are using oxygen. Again, after we finished, we clear the filters. The filters won't transfer between the different tabs, so you'd have to start again in every single tab, but it's also good to clear the filters to not get confused. In the next example, we will look at sex differences in the emotional well-being. So we go to the emotional well-being tab, which shows a couple or selected questions about mental health. We have low self-esteem, feeling isolated, interest in social situation, and feeling fearful, also feeling angry or frustrated, or feeling misunderstood. Plus the last one, feeling guilt, embarrassment, and hopelessness. So we have quite a big range of questions about emotional health, well-being. This example is also published as one of the publications you can find on the PVRI website. So we're going to look into different sex differences. So we're choosing as a category sex at birth. And as a subcategory, we're going to start with female patients. And we can see that these patients, that the distribution of their answers, ranging from very often to never, is fairly normal. It's always a similar distribution for all the different questions, with most of the respondents being in the sometimes group. If we now switch to male and take out the female, we can see that these responses change, and we see that the option never and rarely becomes more frequent. And this is true for all the different sub-questions. So this is an example of how you could use a more general view of the PHGPS to answer some of the more mental health questions. Obviously, you can also filter all of these sections by country or by region, but you can't filter it for two categories at the same time. And we're going to go clear this filter again and go into the last example, which is in the engagement tab. The engagement tab shows you questions about patient-reported outcomes, how it was administered, but also this question about if patients have taken part in the clinical trial. This is one of the main findings of the PHGPS. We found that only, again, if we hover across, only 21% of the global PH population has taken part in a clinical trial, which is fairly low. But we maybe want to see if this is different for each of the diagnosis groups. So what we're going to do, we're going to filter for diagnosis. Again, we're going to filter for diagnosis here in the category. And we're going to start with the group 1 PH in the subcategory. I'm going to scroll back down to the question. And we see before we had 21%, and now in group 1, this percentage increased a little bit. which was up to 25%, so a quarter of all patients who participated in the PHGPS have ever taken part in a clinical trial if they had group 1 PH, which is still not a lot, but a little bit better than the overall population. But if we switch this, we're switching to group 2 and 3, which we know is less represented. Can go to group 2 and 3, scroll back down. So we can see that this percentage has dropped down to 16%. So only 16% of group 2 and 3 patients have ever taken part in a clinical trial. And I think this is it's really highlighting that this patient population is underrepresented in clinical trial, especially if we consider that probably most of the patients with group 2 and 3 PH were part of a patient association and thus are more likely to be under specialist care. And we can go and check that. If we have this assumption, we see only 16%, but probably that's not representative of the global group 3 and 3 population. We can go and check that in the Access to Care tab, where we can see if if patients are under specialist care or how often they visit specialists. And here again, if we apply the same category, so we go back to diagnosis, and we go back to group 2 and 3, we see that 75% or 76% of the patients with group 2 and 3 who participated in our survey were under specialist care, and we would think that this is a population who would be participating in clinical trials as well. But it's only 16%. So these were just 5 short examples of how you can use the different filters and how you can apply them across questions to allow comparisons between regions, between countries, but also between groups of diagnosis. On the website, you can also see at the bottom, you can see links to different, the PVRI website, but also to the related publications to the PHGPS if you want to see more. And also at this point, we want to note that the main questionnaire we had, the main publication we had, has a lot of data in it as well, that is also stratified by region. So if you're interested and you don't see anything, something that is not on the dashboard, you can check the publications if you see it in the publications. And again, if there's any data that you want to see and don't see, you can always ask the PVRI for more data. I would like to invite you, if you have questions and the dashboard is open, maybe you want to ask questions right away. I will give you a minute, and then otherwise we can also move back. Let's see at the questions at the moment. Okay, we can always pull it back up again. So I'm going to hand back to Matt and Hall for the next section.
Thank you, Paula. And there is a question: how can I involve my patients in the survey? You are from Pakistan, so we're going to talk about that in a minute. In how patient associations or providers can involve their patients. Before we get to that, Hall, you wanted to cover this.
Yes. So thank you, Paula, for this great walkthrough of the dashboard. And I don't know about you, but I'm very excited about all this. I think it's fantastic that we have the ability to dwell into all this data. And you can really spend hours on this, trying to find data that you're interested in. And I think it's especially interesting for the patient community to look at the data from their own country and maybe also compare data from their country to a neighboring country, for instance. So now we're really interested in your feedback. So what do you think would be useful for your patient association? And how do you think you could use it, and so on? So if you could please let us know. So I'll give you a minute or so to type something into the question field here. So please use the Q&A box. Maybe if you don't have a question, maybe you have a comment. So not so much feedback or questions at the moment. I think we need to give people time to really look at this.
To play with the dashboard, I think.
Yeah, to play with it, yeah. What are the out-of-pocket costs that patients need to pay? I'm not quite sure what they mean about that.
Where's that question?
It's in the Q&A.
In the Q&A.
Patients, they don't need to pay anything to take part in the survey. They don't need to pay anything to look at this. The dashboard is available to anyone.
If they get an email with the survey link, they can respond to it. It's absolutely no cost. We want people to participate. And there's a question about not much representation in Africa. We're hoping to change that. We want to involve as many patient associations and providers in Africa to get their patients to respond. They have to have access to the internet because the only way they can respond to this is on a device with access to the internet, whether a computer or a smartphone. We make sure that the questionnaire is smartphone friendly. So if you have any way to help us spread the word in Africa, then that will be great.
Yeah, I'm a patient myself, and one thing that we often discuss in the patient community is that the access to treatment and so on is very unfair if you compare global north and global south. And this is really the chance of the community from the global south, Africa and other countries to make your voice heard and to really show and highlight the problems that you might have in your region. So please use your opportunity to take part in the survey.
We also had a couple of questions in the chat. So one question was, there is not a separate region for Central America and South America. There should be, if you're on the dashboard. It's not on the map, but in the dashboard you can, or it's on the map as well, Central America and Caribbean and South America. So you should be able to filter between the two regions.
You can combine both regions to produce all of Latin America.
And that too.
In the report.
You can combine as many countries as you want and as many regions as you want. Yeah.
There's a question about whether the data set contains biomarkers. It does not. This is all self-reported data. We're not pulling from electronic medical records or anything like that. These are patients responding on their own experience. So they are self-reporting the medications they're on, any side effects they may be suffering from, when they were diagnosed, how they were diagnosed, whether they're attending a specialist, what kind of specialist, how far from the center they need to travel, their experience, the emotional well-being, also all self-reported data. So we're not pulling from anything else. So that needs to be taken into consideration.
That's a question if it filters for the state in the US. I don't think it does.
No.
Doesn't matter.
We do not get to that level because, again, to avoid identification. So, but if there's a researcher or a provider who's interested in the US data set, we can work with them, but it's not filter, at least not in the dashboard. If there's a very specific project and someone wants to compare states, then we can talk about it. But in the dashboard, you cannot filter by US state.
But by the way, I think this thing about the regions, I think the regions used is the standard that UN use when they divide into the world into regions.
To answer the other question, could you get access to the data set? I think that's what Anna Celia is asking. Yes, absolutely. The email address that was shared earlier, and if you put back the slides, perfect. Are the slides on? There's an email address, phgps@pvriinstitute.org. If you email there, there's also a form online that you can fill out to request the data set as a researcher.
There was a question in the Q&A about if to participate in this questionnaire, does it need to be translated into the national language? It doesn't need to be translated in the national language. If you speak English, you can answer it in English, but we will aim to, in the second round of the PHGPS, we will aim to translate it to as many languages as possible.
If a patient association for a country that we don't have the language requests to participate, we'll aim to provide the survey in that language. And we've done it with all the patient associations that requested participation. They've all asked to offer it in their local language. And so that's why Hal said at the beginning that it was translated into 22 different languages. And we also need volunteers to help us check the translation. So if you are a native speaker of your in your country, then therefore we will want to volunteer to check the translation. We would appreciate that for the second round. Any other questions?
And I think the important thing is also you need to be good at English as well, because you need to be able to double check that the question in your language is the same as the English one. And I think also to the point about answering this in English, for instance, then you just select the country where you live, and then the results will be applied to your country.
To answer Damari's questions, that the percentages don't show up, they do show up. You have to hover over the bar or the pie, and then the percentage will show up. If you're not seeing that, I wonder if it's your version of your computer, but when Paula was showing it, if you just hover over it, it will show the percentage.
So we had a question, adding 2 blocks does not give you Latin America. We can take this into consideration for the next round, or how to select the regions. Maybe at this point, it's better to select all the countries individually, although that is, I understand that this is more work to select all the countries individually. And some of the countries may not have enough answers to be showing on an individual level.
But we can make that, we can add a region.
We can add a region.
That is Latin America.
Yes.
Sheila, your question about when the second round will be available, we're aiming to launch in 2027. So that's when the revised questionnaire will be available, and we'll go back to all of the volunteers and the patient associations with a toolkit to distribute the survey to their patient populations, and we will also be reaching out to different medical societies in different countries to help us reach their patient populations as well, so that we can reach more people than in the first go around. And those who responded to the survey the first time and gave us their email address to be contacted, then we will ask them to participate again.
Yeah, because the second run will not be exactly the same as the first run. Maybe you can say something about that, Matt?
What was that again? Sorry.
the survey will not be exactly the same as the survey in the first round. So.
Correct. So there will be some core questions that will remain the same so that we can compare, but other questions will be added and other questions will be dropped if they've already served their purpose. Anyone who wants to volunteer, please email the email address you see on your screen. Let me add a few things before we close. Again, to thank everyone who contributed to this project and the comments that you're giving us today and the questions that you're giving us today. That's going to help us make the second round even better. First, I wanted to encourage you, if you're with a patient association, to explore the dashboard and think how that data will be useful locally. So like Paula showed, you can sort of segregate your country and then use this for purposes of advocacy or education in your own country. This is vetted data that you can use for those purposes. We would also welcome your feedback on the dashboard. Like I've seen some comments coming in about maybe not enough contrast between the colors or whether the percentage is showing up. So if you find anything like that, again, email us so that we can make the corrections and what you'd like to see on round 2. And third, as we develop further this project, we would be grateful if you continue to support us with dissemination, translation, and local engagement. That is what made this successful the first time. We got to 4,000 respondents because a lot of you posted on social media, emailed your patients, the patients you had in your database, and basically acted as a broadcast of this project locally. And so that's how we got to 4,000. If you're a clinician or a researcher and you want to access the data set, like I said earlier, there's also an option for that, and you can email us to request the data. And we'd be happy to explore how you can use the data for your own research. PVRI will be following up with materials after this webinar, including all the relevant links that we just talked about. And if you have any other reflections after today, please do send them through in that email. Really, your input is essential in making sure that we get to a successful round 2. Thank you again for your support. And I'd like to know if there's any other comments that we didn't get to.
That's great. Thank you so much, Matt. I would just like to say, on behalf of PVRI, a huge thank you to our hosts, Matt, Paula, Hall, and to our guests for a wonderful session. And thank you to you, our attendees, for giving up your time to attend today. We really hope this has been valuable for you. It's been great to have you here and to have your participation. And I hope everyone has a lovely rest of their day. Thank you, everyone. Take care. Bye-bye.
Bye.
Thank you.
Bye-bye.
Bye.